Hi everyone, here today we're talking about the National South Asian Medical Student Association Anti-Bias Initiative, a longitudinal workshop series. My name is Sree Jambunathan and I'm a second year medical student at the University of Toledo College of Medicine.
And I'm Fatima Maqsood. I'm a third-year medical student at AT Still University. So SAMSA is the National South Asian Medical Student Association, which is a national organization founded by a team of medical students in order to address South Asian health. Our goals are to improve advocacy efforts, promote research initiatives, and cultivate a sense of cultural awareness in the next generation of physician leaders. In 2021, we launched an initiative dedicated to organizing educational and anti-bias events for medical students across the US. Our goal was to create an inclusive environment and promote dialogue on racial justice and related topics for those who identify as part of South Asian communities.
So in order to guide our programming and figure out what topics would be important that we'd want to cover, we sent out a needs assessment survey to medical students across the country who were in SAMSA in mid-2021, and this was sent out via Google Forms. Members were asked to indicate what topics they would like to see the anti-bias committee focus on, and these topics we'll be talking about later in the presentation. But from this, we developed a longitudinal workshop series that then was implemented to facilitate important discussions on diversity, bias, and justice.
So for our workshop series, we held monthly 1-hour virtual sessions in September 21, discussing crucial topics such as race-based pseudoscience and microaggressions. The average number of students who participated in our workshops have been 7 to 10 students from all over the country. And we've also had participation from residents and physicians on some of these workshops as well. And moving forward, we hope to expand the scope of our topics to include things like colorism and medical education research. And at the conclusion of our year-long series, we will be doing a survey to assess participant attitudes towards racism in healthcare, bias, and assess the utility of the skills they acquired through our workshops.
So here are the different workshops we've held each month. So in September, as noted, we had one on using science to justify racism and understanding the history of race-based pseudoscience. And then in October, we had a talk on how to work with and deal with microaggressions. And then in November, we had a talk where patients from South Asian and African American backgrounds were able to share their experiences in the healthcare field. And then in December, we had a talk on casteism and how it may intersect with healthcare and how those factors may impact the type of care people receive. And then in January, we had a talk where we learned about how medicine can be told in different ways, such as through cultural art and dance.
So our workshops created opportunities to engage in topics about anti-bias, and especially as they relate to South Asian spheres, which these opportunities are limited. And this initiative basically helps foster an environment where students can participate in this dialogue and hopefully become more comfortable talking about these issues and spreading awareness about them.
And based on the reflective survey being sent out to the workshop attendees, we hope to see what, if any, knowledge and skills were gained. And we hope to gather data on the most effective techniques for knowledge and skill acquisition and use this information that we've gathered into making a potential longitudinal curriculum. And we also, our goal is to have our participants, get more confident and comfortable discussing anti-racism and anti-bias topics. And in the future, we'd like our workshop participants to be future organizers like we are. Yes, thank you.